Welcome to another one of Geoff's myth-busting sessions. So many times I have clients ask me, does dental monitoring shorten someone's treatment time? And the answer is no, it doesn't shorten treatment. The argument is though, it may shorten the number of visits. And I say may because there have been some studies done, one in particular by Dr. Peter Miles from Queensland, who actually demonstrated that patients who had dental monitoring actually had an increase in the number of visits. Now that article is never spoken about by companies such as Dental Monitoring. That was done as a very unbiased study. Now, where do I sit with dental monitoring? If you practice in a regional area and the patients have to travel 100, 200, 400 kilometres to see you, I think dental monitoring is fantastic. Now, why do patients want to come and travel 3 hours for a 5-minute appointment? I couldn't agree more. But let's take the regional practice aside. And we're looking now at mainly aligner patients because that's what dental monitoring is really renowned for, tracking dental monitoring patients. So in my practice, and the practice I share with Dr. Martin Poon, my business partner, we may see the patients every 6, more likely 8, 10, 12 weeks, give them new aligners. So we might only see them 6 or 7 times for their entire treatment of aligner therapy. And I feel that's important for a number of reasons. It's important that we see them so they feel like they're getting our service. Now, so often we go to this techno junkie phase. Don't see the patient. Yeah, well, let's get back to some personal care. Giving them the feeling of warmth, the feeling that we're looking at them, the feeling that they are getting some value because they're seeing us. It's only 5 minutes of our time. It's not a big deal at all. So if you're in a regional area, I don't believe it's an issue for someone to come to you. Sorry, if you're in a metropolitan area, I don't feel it's a problem for someone to come to you once every 8 or 10 weeks for a 10-minute appointment to give them the warm and fuzzies. But what's even more important than that is the fact that IPR is required on a regular basis. And if you want to know more about that, teach all about that in our OrthoEd course. But suffice to say at the moment, the IPR which the aligner company tells you is wrong. It's totally wrong for many, many reasons. And if you want predictable, efficient tooth movement, you need to do regular IPR when you see them clinically. So if you want your cases to track well, my advice is see them at least every 8 to 10 weeks and do a little bit of IPR. Hence the reason why I don't like dental monitoring. Unless my patients are travelling a long distance, then it becomes worthwhile. And here's your other issue. The more patients in dental monitoring, the more you have to employ somebody to monitor the dental monitoring. It makes no sense whatsoever. So that's just where I stand. Everybody can have a different opinion and that's all fine. But at the end of the day, I'd like to see the total financials of a practice who does dental monitoring, the extra costs that are also associated with it, and does it really make that much difference to their bottom line or not? And I would argue I don't believe it does make a difference to their bottom line because of the extra costs associated with it, the extra employment, and the problem sometimes with cases not tracking as well as you would like them to. So that's just one man's opinion, and I'm happy for people to argue against it, but that's what I've seen over the last 4 or 5 years.